So what kind of what's the toughest surgery or procedure you had to do in your career?
The
That you remember?
procedure. The toughest procedure that I had to do in my career probably would have been a sinus lift, and it was probably the closed approach sinus lift, which is like an osteotome, and pretty much what you do is you make an access opening in the premolar region, and you try to lift up the sinus. And when you lift up the sinus, it being closed, meaning that you're coming from a little hole at where your ridge is, and you're tapping that bone up so that you can actually lift the sinus up. But I remember my very first patient that we had to do a sinus lift on. She said, I think you tapped me like 80 times. Lord, I was wondering when you were going to be done. So I mean, I think that was probably the most challenging, only because you're a resident at that point in time. You don't really want to like hit somebody hard. You just want to kind of tap tap, okay, tap tap. But later on, my instructor came in and was like, what? And it was like, okay, open sesame.
When do you need a sinus lift exactly?
Sinus lifts are usually needed when you need to do an implant and you don't have enough space for that implant. So if like the sinus has what we call pneumatized drop down, and you have less than a 10 millimeter space, at least 5 millimeter space between the base of the sinus to the base of your alveolar ridge, you want to lift that sinus up. You can do an open approach also, which is basically accessing it through the zygoma. But in this case, we decided to go and do the closed approach. But yeah, it's pretty much sinus lift is used in order for you to do an implant later on. You raise the sinus up, you fill it up with bone, you place an implant in that area. It allows the patient to have that implant that they also need.
With the maxillary sinus?
Mm-hmm. You don't do it through the maxillary sinus per se.
Okay.
Yeah.
So Dr. McIntosh.
Mm-hmm.
So tell us about your dentistry background and how you became involved in periodontics.
My dentistry background. Well, growing up, I really didn't know too much about dentistry. I can say that my mom would say that I would sit on people's lap and look inside of their mouth. So pretty much, I guess I had an affinity towards teeth at an early age. As far as periodontics is concerned, it was probably around my third year. And in my third year, I brought my mom in, because moms always do what for their children. So I brought my mom in, and I was starting to do my examination, my initial exam. And as we were doing the initial exam, I was realizing that her probing depths were really big, and we had learned about periodontal disease. Looked at her radiographs with the instructor, and was just like, wow, Mom, you're losing my teeth. And she would always tell me she went to the dentist, but I guess, they never really did a thorough examination of her. So from that point on, I kind of got more interested, I guess you can say, in periodontics as a whole, just because I wanted to know what I could do in order to help her out.
Interesting.
Mm-hmm.
So how does periodontics differ from general dentistry?
Differ from it? I don't think any discipline really differs from general aspect.
Well, how is it different from?
I guess the difference is that you just mainly focus on bone and gum disease. Whereas when you're a general dentist, you pretty much have to focus on all realms of dentistry. Periodontics makes you focus on that one thing, that scope of dentistry as a whole, which is very enlightening. I mean, at the same time, because you get to, it's a specialty. So when you focus in on something, you get to focus in and know that topic very well. But in the same respect, as a periodontist or any specialist, you should never forget your general dentistry background. You should never learn how, to fill teeth. You should never forget how to do any type of prosthodontics or any type of implants or anything like that. And the reason why I say that is because as you're doing your treatment plan for a lot of patients, you have to take all of that into consideration. So you never just have like the reins on your eyes. You always want to make sure that you have a broad idea of what's going on everywhere else, so that you can make sure that you have a complete treatment plan for your patient.
So what does a typical normal day look like for you?
Well, because I guess you can say 80% of my time is in the school system, so pretty much my days begin at coming here, talking to students, making sure that we have a day planned as far as I finish out my lecture with them, then I go on the clinic floor, I talk to them about their cases, try to figure out what they need to do, give them a better understanding of treatment for the patient. A lot of times the students will tell me I drill them, but it's drilling so that they can get a better understanding. Only because when they have a patient, they can't just separate everything off into disciplines. They kind of have to join all the disciplines together and have an understanding of what's going on. As far as practice is concerned, pretty much the days start off with you doing some of your hygiene checks. You go in and do a lot of your surgeries in the morning because it's just a lot easier to do surgeries in the morning. You're fresher in the morning. And as far as the afternoon is concerned, you just go ahead and you do the non-surgical aspects of your practice.
So what types of procedures does a periodontist perform?
Okay, so in periodontics, I know as you guys matriculate through here, you'll probably think that periodontists do more of scaling and root planing. We don't just focus on that. That's what hygienists are for also, to help us. I mean, hygienists are there to aid the general dentist and the periodontist as far as making sure that their patient's oral hygiene is maintained as much as possible. So I would pretty much say that the average periodontist does a lot of surgical techniques as far as minor surgery. So we do crown lengthenings, we do osseous surgeries, gingivectomies, implants. You have your bone grafting, you have your soft tissue grafting. I mean, the list pretty much goes on. We don't really stop. It also kind of is based off of your comfortability. I don't ever encourage anybody to do something they're not comfortable with. So if you don't feel like soft tissue grafting or hard tissue grafting is your thing, then don't do it. But you pretty much have a wide range of minor surgical techniques that you can do with your patients.
So do you only perform at one clinic or other clinics or with other different types of doctors?
Well, actually, I perform whenever a person meets me. Like, I have a lot of friends in the area, so if they need a consultation from me or if they need me to go in and do any type of surgical procedures, I will help them out in that respect. But pretty much I focus most of my energy here. Like I said, it's 80% of the time that I'm here.
So when should patients be referred to a periodontist?
Pretty much patients should be referred to a periodontist when they have more of a moderate to advanced case of periodontitis, meaning that they have lost a significant amount of bone. And in that case, it's kind of hard for the general dentist to keep a watchful eye on them because it's so advanced, and you don't want the patient to lose any more bone or teeth. So you kind of want to send them off to that periodontist so that they can take a little bit more care with them.
So what advice do you have to offer to patients with gum disease?
With gum disease? Well, because gum disease can pretty much spread to a bone disease, I would tell patients that if you do have a form of gingivitis, that you should get it taken care of, because gingivitis does precede periodontitis, which is bone and gum disease. So if it does form into a bone and gum disease, which is periodontitis, I would definitely go and see my local dentist to make sure that things do not progress, because periodontitis has been shown to have some systemic effects also with patients. Like when you look at your cardiovascular patients, those patients already have a chronic inflammation, and the association between periodontitis and cardiovascular disease isn't direct. However, the commonality between the two is a chronic inflammation. So if a patient has cardiovascular disease and periodontal disease, I usually tell them, just go ahead and get your treatment done so that we can reduce the amount of inflammation as possible. And those patients with diabetes, especially uncontrolled diabetes, you want to make sure that you keep that disease level down also, because you know diabetes is like sugar just sitting in the system. So because that sugar is sitting in the system, periodontitis is, or any type of gum disease, is bacteria. They love it too. So they're sitting there and they're eating away at it like termites, enjoying the meal. It's like a buffet for them. So the whole point is to actually remove the toxins as much as possible. Once we remove the toxins after doing periodontal treatment, then we begin to notice that the patients that have diabetes, their glucose levels actually start to reduce. So then in that fact, that helps them also. So we do have dual effects.
Okay. So in your opinion, how can patients best prevent that gum disease?
You know, in some cases, it's kind of too easy to say, oh, well, you can just brush and floss and that will indefinitely eliminate it. because there are other risk factors to you having periodontal disease because it's so multifactorial. However, we do know indefinitely that bacteria is a cause, microbial plaque is a cause. So in saying that, brushing and flossing twice a day is indefinite, and just making sure that you are doing it appropriately. You know, you have a lot of patients that don't understand the techniques in brushing and flossing. So as a dentist, you have to make sure that you encourage your patient and inform your patient the correct way of how to brush and floss their teeth. So hopefully that will reduce the chances.
Hopefully.
Yes.
So what advice would you give to those who are interested in becoming a periodontist?
The advice I would give a lot of students is to make sure that they go to like an externship to actually see if that's what they want to do. I know a lot of people will, you know, and it's an unfortunate thing, a lot of people look at specialties so that they can actually gain more money. Dentistry is not a point where you actually want to think about gaining more money, especially if you don't love that aspect of it. You want to make sure you love doing it because you have to wake up every morning with the focus of doing something like that. So if you are going to go into any specialty, especially periodontics, because it is a lot of reading and it's a lot of you having to troubleshoot through things that just don't seem to be apparent to you, you definitely should do an externship and see how residents take care of their cases. You should go and see how a local periodontist takes care of his cases, what his natural day is like. And I would say that for anybody who just even go into the scope of oral surgery or pediatrics to actually see what that person does in that day so that you actually know that this is what you want to do.
How competitive is getting into periodontics, that specialty, precisely?
I would say it's competitive, but it's probably not as competitive as you going into oral surgery or orthodontics. I think orthodontics, radiology, and oral surgery are really hard to get into. My class had 3 people. Usually it's about 3 to 5 people per class in a residency. So it can be quite difficult for you to get in, but it's probably in the top 10 or 20, it's probably in like 9 or 10. Yeah, so it can be pretty difficult. It's not something that everybody wants to go into. Most people, like I said, most people think all we do is scaling and root planing all day, which is not true. Until they get to their GPR program or AGD program, then they realize that that's not all that we do.
So if you could rewind and do something differently, or would you do anything differently?
No, I
Would you change anything?
I wouldn't change anything. I love what I do as far as periodontics is concerned. I wouldn't change it so that I would, you know, say, oh, I can be an orthodontist, because I never really did like bending wires. Sorry to all those orthodontists out there. Pediatrics, I love children, but I don't like them in my chair. Oral surgery, I cannot see myself getting up, you know, to go and take care of a trauma, or I just never really liked those big major surgeries. So, I mean, I like surgery. I like getting my hands wet as far as that is concerned. So, if I had to do anything, I would stick to what I got. Definitely. Not really a pros girl either.
Okay. All right. Well, thank you very much for having me, having me interview you.
Oh,
I appreciate it. Thank you.
you're welcome.